When I first got diagnosed, a month after I gave birth to my son, he was born in September, and then October 20th, a month later, I was diagnosed with the virus. And I didn't know that I had it until like 10 years later, and then I found out that I had it. And then people were just dying all around me, and by the grace of God, I was hooked up with ACQC. I don't even know how I hooked up with ACQC.
With ACQC starting in HIV services in 1986 and AHF in 1987, these paths were bound to cross because with both organizations, you find caring people who love the community, who fight for what's right, and who are strong in providing these services for those who have the greatest need. And so it just made sense.
I guess the nature of the services that we provide since the 1990s that has changed significantly is the population that we service.
Well, being a person born and raised in Jamaica, Queens, it is my pleasure to say that the population here is quite diverse.
Bueno, yo puedo describir la comunidad de ACQC como personas muy amables, tratan a todo el mundo por igual, no he visto nunca ningún tipo de discriminación. Al contrario, yo veo que todo el que llega a ACQC es igual.
Nos tratan verdaderamente como si fuéramos amistades, no como si fuéramos clientes, de verdad. La verdad, yo me siento muy a gusto y yo creo que todas las chicas que pertenecen a ACQC lo tienen que reconocer porque siempre nos han tratado con mucho respeto, tanto en el shelter como acá.
AHF and ACQC at one location gives the client a one-stop shop. Everything they need is right at the grasp of their hand the minute they walk through that door.
My job as a pharmacist is not only just to fill prescriptions and dispense to my clients. My job is to make the client feel comfortable.
They're all about Smile, all about helping the people in the community, willing to put their effort, their time into you. You just need to put their effort back, because if you're not picking up the phone, then how are we supposed to help you? You know what I'm saying? If you're not taking your medicine, how are we supposed to make sure you're safe? You know what I'm saying? These are the steps that you need to take to make sure you are doing the due diligence.
There are many organizations that will do the work of healthcare, but they don't focus on the deficits that cause the healthcare to be a problem. And so this organization has given a lot of leadway for patients to have access to several opportunities to make sure that healthcare is intact, whether it's socioeconomic, whether it's just medication, whether it's just someone that looks like them to help them along their path.
También, porque no solamente nuestra comunidad LGBTQ, también la comunidad de la sociedad en que se desenvuelve, que aquí en Queens o en Brooklyn, Jamaica, ACQ está en cada momento observando nuestra comunidad y dando ese apoyo que tanto nos merecemos para poder ayudar a la sociedad a ser mucho mejor.
I feel like it's important for the community that ACQC exists because it provides a safe place where people can come, be themselves, be comfortable. Unfortunately, being as part of the LGBT community, I'm very aware how often we get shunned by society, by family, by school, by work, and it's just important to have a place where you can come and feel like you belong.
When the pandemic started, from that warm, fuzzy feeling and handoff and people coming in, you had to now do a lot of it virtually.
It's really more effective, indeed, when you meet people and you see people and you talk to people. And now we have to talk to people over the phone that we don't maybe see for like 1 year or 1 year and a half.
That inability to help where one is trying to help, that inability to control all the variables and ultimately losing a patient definitely takes a toll on a provider, on families, on communities, and yes, we're still recovering from that.
Our staff were here feeding the community and even finding housing for the homeless. We found about 10 permanent housing per month, which was unbelievable at that time.
The new challenges that we had to face when the pandemic started is basically we had medication, we were able to get medication, but we weren't able to get people to staff the pharmacy. I worked with a limited staff in a building with 7 floors with only 5 people.
You know, when COVID hit, we were out here in Far Rockaway, delivering food and, you know, just still meeting the needs of the people, and then having our own challenges.
I think we were feeling, or I was feeling, and even a lot of our staff were feeling a lot of anxiety. There was underlying depression because it was like, you know, people couldn't come out. We couldn't do the same activities we were doing with our clients, with the community, you know, even moving our food pantry to the street, wearing gloves and masks when we gave out food.
But the way we were still able to work together, find other ways to keep in communication through Teams or through video chat, Zoom calls, we still made it through. Sometimes it was emotional seeing each other through the camera.
It's been some sadness. People have passed. People, you know, were scared. People were, you know, just confused. I mean, I was kind of confused myself. You know, where do I go? You know, but through the encouragement, through my faith, and just working here at an organization that we just helped each other.
At the end of the day, we know that we are here to give the services. So that's exactly what we end up doing, because this is exactly what we signed for.
Well, there were a lot of parallels with COVID that you saw from the onset of HIV, because people did not know what was happening, how, you know, who was infected, how they would, you know, how that would impact them, how it would impact their families, and people were scared.
I think that ACQC is always very resilient. We've made it through the hardest years when people were dying every week. We had 10 deaths every month. We attended so many funerals, and I think that has made us stronger.
Me, myself, that's been here for 22 years, I can tell you, it's like a big family.
Since I was little, I was supposed to work for ACQC. I guess growing up in a dysfunctional manner makes us all normal. So all us people that grew up in a dysfunctional manner happen to meet up at ACQC.
Kindred spirits find each other.
I didn't know that I had that in me. Like, I like to help people out. That's like that. I've always been like that. So I felt like this was the right place for me at the right time.
I want to celebrate life. I want to celebrate that we made it. I want to celebrate that we are awesome. I want to celebrate that we continue. COVID, you are not going to stop us. Our theme song by Beyonce, you know, you're just not going to break my soul, and you're not. You're not going to break my soul, because together we stand.
Hemos reabierto nuestras puertas, estamos aquí para ellos, que no hemos cambiado, al contrario, ahora hemos venido con más fuerza después de la pandemia, más unidos, todos en la agencia, con más educación como nos la dan día a día, porque para que nosotros recibimos siempre educación de ACQC, para nosotros poder pasar esa educación a los clientes. Y es un buen resultado porque la comunidad nos busca y nosotros estamos ahí para ellos.
We didn't lose faith. We turned around and said, we can do this, we can handle this. As a nation, as a community, as a world, we can get past this, but we're gonna have to rely on each other to do the best of this, because we all represent the best of who we are, and we can make this happen together. And it happens starting with hope, because that's the thing that inspires us, and that is our fuel.
It feeds all of us. It's edifying to the soul, and that's all I have to say about that.
I know that our future is bright because of what we have gone through. We can do anything.
Either you do what you need to do, or you just give up, and those are the requirements. Is not to give up, it's to survive, it's to live, it's to do the things you need to do, and it's to build yourself up, plus help others like you. And that's what ACQC is all about.
We experienced a lot of pain, a lot of suffering, a lot of grief. People that we lost to infection, to COVID, to, you know, abusiveness, especially in the LGBT community where we're shot be down and all that. There is light in the end of the tunnel. Believe that, because even though there could be a lot of red in this picture, just know that we're born and brought up into this world out of something, and that was out of love right here. We just need to remember who we are as a person. Because
Good afternoon. I'm New York City Council Speaker Adrienne Adams. Thank you to the AIDS Center of Queens County for hosting today's annual World AIDS Day event at JPAC. Since 1988, World AIDS Day has served as an important reminder about the importance of our united mission to eradicate HIV and AIDS. On this day, we also reaffirm our steadfast commitment to support people living with HIV/AIDS and to remember those whom we have lost to AIDS-related illnesses. Since its founding more than 35 years ago, ACQC has grown to become the largest provider of HIV/AIDS services in Queens. By providing comprehensive services, raising awareness, and supporting individuals and families living with HIV/AIDS, you have made our communities healthier, stronger, and more resilient. Thank you to Rosemary, Robert, and the entire team at ACQC for all that you do for the Borough of Queens. And congratulations to today's honorees. Have a great event.